And the latest numbers have, in fact, just been reported here this morning. Let's update you on them. South Africa has 3,755 new cases from the last 24 hours. 76 new COVID-19 related deaths have also been reported in the latest reporting cycle. That represents almost a 12% positivity rate. Yesterday, President Cyril Ramaphosa announced that the country will, from today, move to adjusted alert level 2 of the lockdown, following the rapid rise in COVID-19 infections. Making the announcement, President Ramaphosa said 4 provinces were already in the third wave. Now, to make sense of what is causing the worrying increase in the COVID-19 numbers, we are joined by Dr. Ridhwaan Suliman. He's a senior researcher at the Council for Scientific and Industrial Research. That's the CSIR. Great to have you on the show. Thanks so much for being with us.
Good morning, Leanne. Thanks so much for having me.
It's a pleasure. I follow you quite religiously on social media, watching your analysis. And I mean, you've been giving us your sort of insights into it with the numbers every single day since the beginning. So we do appreciate the effort that you've put into it. But let's come to the here and now. You yesterday had said it looks like we're firmly into a third wave as a country. President saying only 4 provinces so far. What do you read from the latest numbers?
So certainly, if we look at what qualifies a region or the country to enter a third wave, there's no general adopted international guideline. What we use in South Africa is a case threshold, 30% case loading compared to the previous wave's peak. So based on that, South Africa's 7-day rolling average currently, just with the latest numbers just released, stands at 3,900 new cases on average per day, and that's up to 21% of the second wave's peak. So not quite surpassing that 30% threshold, and hence why we're not formally or officially in a third wave nationally. That being said, I think we also need to point out that the test positivity rate, as you were just saying earlier, continues to increase and is well above 10% now. So a separate metric to really indicate that the rise in infections really is real, and that for all intents and purposes, how we're defining a third wave currently in the country may just be a matter of semantics. It's probably just a matter of time when we officially pass that case threshold nationally. As you mentioned, 4 of the provinces have passed that 30% threshold, and they are officially in their third waves.
How reliable are these numbers? I mean, let's start there, because you know when you speak to people, you seem to, by word of mouth, find out about more people that have COVID. Then when those numbers come out, you think, really, is that? Oh, okay, that's countrywide, only that amount. Talk to me. How reliable are these? I know we depend on them entirely, but is this a true reflection of what's actually going on in the country?
Well, we need to understand that all of the numbers and all of these indicators do have limitations, and that's why it's important that we track a number of different indicators for COVID. We look at the number of cases, as well as the testing rate. We look at hospital admissions, as well as deaths. And then if you compare the trends in all of these indicators, you really ought to see the same trend in all of them. And so that's why it's important to look at the different measures and the different trends in them. I do get your point that there are certainly limitations in the data. If we look specifically at the number of cases that we're reporting, it is certainly limited by the number of tests that we do conduct. And our testing strategy in South Africa is based on when people present for testing, either after showing for symptoms or coming into contact with a positive person. So therefore, we don't really go out and do mass randomized testing. So certainly the number of reported cases is likely an underestimate of the true reflection of the number of infections on the ground. That test positivity rate really does confirm that there may be many more undetected cases. Maybe just as an example, during the surges in our previous waves, the first and the second wave surges, the test positivity rate went above 25 and above 34% respectively, indicating certainly that there are many more undetected cases in reality.
Yeah, certainly. I would imagine that is the case. But let's talk to your analysis. And when we look at the upward trajectory that we're in now, so what I understand was the last time we saw these kind of numbers was back in February, when we started seeing a decrease of the second wave. So are we looking the same in terms of how we did as we entered into that second wave, from the beginning of the second wave?
Yeah, so if we look at when we were last on an increasing trajectory and reporting this number of cases, it was towards the end of November 2020 as we were entering the second wave back then. And then similar number of cases and test positivity rates were reported as we were exiting the second wave in February, as you indicate. At the moment, look, I don't quite have the exact data to confirm the comparison between the where we now and the same time in the second and first wave, but just looking at the graphs and the trajectory, it seems like the second wave was certainly a lot steeper. Remember that at that point we had this new variant, the B1351, that had become dominant in the coastal provinces and spreading quite rapidly inland. The indication just from looking at the graph is that we were certainly on a sharper trajectory then. We're not quite so steep at this stage. I think it does need a bit of closer look, though, to confirm that.
Indeed, it is something that we need to certainly keep a very, very close eye on, and make sure that we look at these numbers and see how South Africa starts moving up. Now, obviously, we heard from the President last night giving us a few restrictions to put in place. We're talking about a curfew. We're talking about curbing numbers of people that are gathering together. Is this enough? Do you think that for now that is enough to try and assist bringing these caseload numbers down, or we maybe needed a bit more? What are your views on it?
Look, I think we need to look at what tools we have available in our public health response toolbox to contain and to minimize the spread at this stage. And if we look at where we're at in terms of our current trajectory, I think a lot of the interventions and measures now would certainly go a long way. The most important one is probably the limitation in the size of gatherings. We do know that super spreader events are the most riskiest, where COVID-19 is an over-dispersed pathogen, and 10 to 20% of infected people are responsible for 80% of onward transmission. So certainly if we minimize large gatherings, we can minimize those super spreader events or cluster outbreaks and slow down the transmission. And I think that's the main focus for limiting numbers, particularly indoors, where ventilation may not be as good as outdoor settings, and the risk is increased. Then beyond that, I think moving the country to a higher alert level signals is basically that the risk has now increased, and I think it's an indication for the public to adjust our behavior and to take note of this rise in infection rates and the rise in risk. So I think a lot of the time we probably base our behavior on what the alert level is. It was at level 1. Moving to a higher alert level could indicate that people should adjust their behaviors. Yeah. I think perhaps we could have maybe gone a bit further, and in those provinces that are seeing surges and are officially in third waves, possibly we could have limited indoor gatherings to 50 to really try and contain the spread as much as possible. I think maybe we could also have looked at specifically at any more interventions in those provinces that are seeing a rise. We'd really want to contain that rise as much as possible in the 4 provinces that are currently in a third wave.
Can I ask you, in terms of hospital numbers, how are we looking? Because that's always the major concern, is that we saw towards the end of last year, the beginning of this year, that hospitals were filling up. People could not find beds anywhere. And that was really the desperate situation that South Africans were unfortunately in. We've seen this repeated in different countries around the world. How are the numbers looking now, particularly in those provinces where the third wave is being experienced?
Yeah, so not unexpectedly, the number of new admissions across the country is increasing, following the trend that we see in more people being infected over the last few weeks. If we look specifically over the last week, there have been 3,200 new hospitalizations nationally, and that figure has increased by 17% week on week. In the provinces that have been seeing a sustained increase, the Free State continues to see an increase in the number of new admissions. It's been increasing for the last 5 to 6 weeks now. The rate of increase has slowed, but I think that province has seen a large number or large demand within their healthcare facilities. In the Northern Cape, which has also been seeing a sustained increase since the Easter long weekend, new hospital admissions last week actually showed a slight decline compared to the previous weeks. So possibly some good news there, although we do need to wait and see. I think the most concerning right now is the sharp rise in hospital demand in Gauteng, where new admissions increased by almost 40% last week compared to the previous week, and then also in the Northwest, and then in Western Cape as well, signs of an increase in admissions by 15 to 20% in those provinces.
I remember at the end, when the end of last year, we started seeing the president institute different municipalities. We saw restrictions being put into those municipalities, not necessarily a nationwide level adjustment. Do you think that could have assisted? I mean, just hearing from you, the very big upward tick, particularly in Gauteng with hospital admissions, that's a little bit worrying.
It certainly is worrying. I think, look, we have been seeing steady increases in a number of districts and regions since the Easter long weekend, particularly after Easter. The rise in Northern Cape and Free State remained sustained. I think at that point we probably could have looked at differentiated approach for hotspots, or even the province that were seeing these sharp rises, and tried to really act quickly and contain the spread in those provinces. Since then, we've seen that the rise has spread into Gauteng, particularly starting in the Sedibeng district, and then spreading into all of the other districts in Gauteng, rising sharply for the last 3 weeks. And then we're seeing that this rise has continued into neighboring provinces of Gauteng, Northwest, Mpumalanga, and recently Limpopo also showing signs of increase. And no doubt this will soon follow into Western Cape, and then later into Eastern Cape and KwaZulu-Natal. So certainly, if we try and contain those regions that are possibly seeing cluster outbreaks and super spreader events, try and minimize those more quickly, we really could go a long way in delaying the transmission rates and the spread.
Two more things I want to talk to. Firstly, and quite importantly, the spread amongst children at this point in time. I did see a report coming through from the National Institute for Communicable Diseases looking at a bit of a rise in infections in children. Obviously, we've heard this through school activities, but it seems like the very young children are more susceptible to getting it this time round. I'm not sure if you focus much on that and have looked at those kind of numbers that have been coming out. The children below the age of 19 and even younger getting this as opposed to the previous waves. What are you noticing here?
So I haven't we don't have publicly available age-specific data. At least I haven't looked at that recently. The last analysis that we sort of looked at was during the surge in the second wave, where we had those super spreader events, particularly in high schools. And we're trying to understand whether the B135 variant was spreading more rapidly in the younger age groups. At that point, the indication was outside of those specific cluster outbreaks for those high school students, there was no noticeable change in transmission between or in the younger age groups. It certainly remained fairly consistent with what we were seeing before. I don't know what the latest age breakdown is. I think with schools open over the last few months, we certainly are seeing outbreaks in communities where transmission rates are high. We're seeing similar outbreaks in schools in those regions. But in terms of a higher transmission in younger age groups, I don't quite have the data to confirm that.
No problem. We'll invite the National Institute of Communicable Diseases. They've got quite an interesting analysis on there, so we'll hopefully bring them in to talk about them. I think it's well worth having a good attention on that. Then finally, we had that last graphic up in terms of the death rate currently being experienced in South Africa. Perhaps you want to talk us through this one. How are we looking in comparison to the last waves that we've had moving into this one? Are we seeing the death rates increasing? Talk to us about this.
At the moment, the number of deaths is fairly stable. This graph shows the reported COVID-19 deaths, and on average we're reporting about 90 new deaths per day across the country. You'll notice that it's fairly similar compared to a week ago. Certainly not as high as the highs we saw during the peak of the second wave, where we're reporting over 500 new deaths per day. But bear in mind that there is a lag between people being infected to being hospitalized and then ultimately, unfortunately, succumbing to the virus. So one, we do need to remember that there is a lag, and this indicator will unfortunately tick upwards as the number of new admissions have continued to increase. And two, the number of reported deaths is lagging a bit due to many provinces undergoing data verification and maybe reporting a backlog of deaths from weeks or even months prior. So not always really possible to read too much into this particular indicator, but unfortunately it is the reality that the number of deaths will increase as the infections will continue to increase for at least the next few weeks now.
All right, let's leave it there. Dr. Ridhwaan Suliman, pleasure speaking to you this morning. Senior researcher at the CSIR, talking to us about the worrying increase in the COVID-19 numbers. We have those numbers. Sakina will bring them to you in our latest news bulletin at 7 o'clock. It's over to you.